How are you doing today, sir?
I'm doing fantastic.
You know, we recently did a couple of knee injections back in approximately a year ago, in March of 2019, for some bad arthritis. Just wanted to kind of do a follow-up and see how things are going. Let me just kind of tell me what's happened over the last year.
Well, before I had the injections, I had a problem, particularly going downstairs. I had knee pain. Sometimes I would have that coming upstairs. So I investigated this, and I came up here, and y'all injected me on the same day I come up here. And today I finally returned to see what the follow-up looked like. I knew I didn't have any pain, but I just wanted to see what it looked like on x-rays. And I'm shocked, frankly. I can see that the space that formerly was there, almost bone to bone, is no longer there.
Mm-hmm. So, I mean, as far as resolution of pain, how would you quantify that? Did you feel like on a 0 to 100% scale, do you feel like?
Zero pain.
Zero pain.
Zero pain.
Okay, great.
And I work out.
You're working out. So your quality of life is better?
Oh, yeah.
Your functional daily activities is much better?
No problem.
Well, I'm so happy to hear that.
I'm thrilled to death.
Yes, sir. Yes, sir. Well, I'm so glad that you're able to share this with with us, and I'm glad that we're able to help. Anything else? A lot of patients will come in and be apprehensive about what we do and things of that nature. Do you have any reservations? Any advice for patients?
No, I have no reservation whatsoever. I know it worked, so it's not a question of that. Yeah. I don't take ibuprofen. I don't take Aleve. I don't take anything for that problem that I've had, and I'm fine.
Well, that's great news.
And I'm 84.
Amen. Well, that's beautiful. Well, thank you for sharing.
I'm not pregnant.
Yeah.